still looking for more hands to come and help, because the more doctors that we have, the less the workload.
Okay.
Over the past 3-4 years, we also managed to improve on the skill mix of our nurses. We have managed to encourage and mentor quite a number of nurses to take up specialized training in pediatric nursing, neonatal intensive care. As we speak now, we have currently 3 anesthetists in training, and we have 3 anesthetists on site. We also have people training in emergency nursing, critical care nursing, perioperative nursing, and the likes. That tells you that we are actually preparing ourselves for a major takeoff within the next few years.
Okay, Doc, what kind of cases do you say are prominent that call at your doors for service?
Well, I would say challenging cases. Most of the challenging cases we have are normally due to RTA. Those who come with head injuries, moderate to severe head injuries, as well as those who also come with open fractures of all manners. Okay. They are patients that when they come here, aside being stabilized, we are not able to give them a definitive treatment. Okay. So most of them we have to refer them to either Tamale or Boko, and that brings up the case of the means of transport. There is no reliable ambulance system within the municipality. Many times we have to call all the way from Boko or Boga before you can get an ambulance, and it's really hampers a lot of progress. Okay. Aside this, within the hospital, like I said, aside the infrastructure, the buildings,
other logistics like
water is a major problem. The problem with water has got to do with its storage. Okay. A big hospital like this, we are using an overhead tank, which was built alongside the hospital, and if you inspect it, you realize that it's virtually totally rusted. Okay. We have done a lot of repair works on it. Thankfully, with the help of some benevolent individuals, we've had a lot of mechanized boreholes dug around the hospital, so we have very good yield of water. Okay. The only problem has been the initial storage. So, and this is an area that we think that if we get external help to help us, acquire a new overhead tank, one that can, store large volumes of water, I think it will really help us. Okay. The other one is erratic power supply. Okay. Anybody who lives in Navrongo, can attest to this fact.
The facility doesn't have a standby?
We have a standby generator, but standby generator can run for not more than 18 hours. Okay. So at a go, there are times that you can run standby generator almost the whole day. That is not good for effective service delivery. You end up spending a lot of money on fuel. Okay. Aside that, the manner in which the power supply is interrupted also, pose a very big problem to our equipment. In a day you can just get flash-offs, comes on and off for close to 15 times, and that is not really very good for the equipment that we have. Mind you, medical equipment are very expensive. Sure. And it's really hampering our progress. And with that regard, we are thinking of getting a few solar panels to support in some of the critical service delivery areas. As we speak now, we get oxygen in cylinders from Tamale and Kumasi, and for that reason, there's a limitation to the amount of oxygen we can have per time. Okay. As a result of that, we depend so much on oxygen concentrated, which depend on electricity. So the moment that you get power interrupted, and for some reason the standby generator is not powered, then it poses a lot of threat to the patients who are dependent on it.
Okay, Doc, we are half year exactly this month, and maternal issues is something that is very critical to government when it comes to talk of health. Are you able to tell me a beautiful story about your records of maternal deaths, or should I say maternal safety
indicators?
Yes, please.
There's a lot to be proud of in this hospital when it comes to maternal mortality. Like I said, a lot of efforts have been put in the past 3-4 years. As of 2015, 2016, 2017, maternal death was hovering around 6 deaths. Per year, 7, and it never went below 6. But I'm proud to say that last year we were able to beat maternal death to 1. From a figure of 6 to 1.
Okay.
And it's half year this year so far. We had just 1 maternal death, and in fact we were doing our best to maintain a 0 maternal death this year. But for some reason, you plan and then nature also plans. So we had 1 maternal death so far. We've audited it. We've learned a lot of lessons from it, and then we have braced ourselves up. We hope to keep it at 1. We don't hope to get any other maternal deaths at the end of the year. And one of the reasons for the success has been the collective efforts, availability of skilled health personnel, and then also collaboration with the surrounding districts. Previously, a lot of the maternal deaths we had were coming from the surrounding districts, but now we have a very open communication channels with them. We are in touch in case of any case, and the doctors are fully available to provide the needed interventions.
Okay. Doc, you mentioned a couple of challenges or problems, so to speak. And I know by extension the Municipal Assembly is that closest arm of government that is close to you. And of course, your services here are to the benefit of the constituents of the municipality. Have you reached out to the Municipal Assembly for some sort of help?
Oh yes, we are in constant touch with the Municipal Assembly. And I must confess that their gestures has always been encouraging. Yes, we know. As a government arm, but they also have their own challenges, and they are taking care of the whole municipality. But like I said, in the past years, they've supported us, particularly in renovation of our doctors' bungalow too. Accommodate 2 of our doctors. Assembly has been very instrumental in that, and subsequently they've also been supportive in terms of financial help to undertake certain outreach programs here and there. And as we speak now, we are still in talks with them to see other areas of collaboration that they can really help us to. To develop the institution. Okay.
Doc, can you also brief me if you have had some external support from, say, specialists who do visit a number of health facilities across the country to do surgeries like cleft and all of that? Has your hospital has any kind of benefits from such expert visiting services from professors in the medical field?
I can talk of 2 main outreach groups that have been coming to this hospital to more or less augment the service that we are providing. We've had a group of Kasnan and Kana doctors who come on a yearly basis to perform surgeries and consultations. And normally the group involves a number of general practitioners and some specialists as well, like obstetrician, gynecologists and urologists. They come and provide these services, which otherwise would have had to be referred to Tamale or Kumasi. The other group is the Apredec Medical Group, led by Professor Abantanga. They also come on an annual basis to also provide a requested outreach on a requested specialty, particularly so we are able to determine which area we want a specialist in. The last time they came, we requested for a urologist, so a urologist came and did consultations and surgeries as well. Subsequently, we are hoping that we can get all the other areas. A pediatrician could be also requested for services during that time.
All right, thank you very much, Doc. Yeah. Oh, great.